Hi there and welcome back to NeeCAT. In episode number 2, we have presented the benefits of NeeCAT as a new digital learning platform for TKA and how to use it. In this third episode, we would like to show you two things. First, how NeeCAT fully automatically evaluates the results of the users. And second, how the overall training concept of NeeCAT is structured and why it is unique. But before we start, let's welcome the founder and medical head of NeeCAT, Professor Heiko Greichen.
Hello Gunther, and a warm welcome for all our viewers also from my side. As you mentioned, this episode is quite important as we explain a completely new case-based training concept, and we also go a bit deeper on the evaluation functionality of the tool. But before we start, can you please give us a quick recap on the last episodes?
Okay, quick recap from the last episode. NeeCAT is a web-based training platform for orthopedic surgeons who want to become familiar with the decision-making process of total knee arthroplasty procedures. In episode number 1 of this series, we introduced the overall concept of NeeCAT and the benefits of this digital tool. Episode number 2 was a guided tour of one specific clinical case. Today, we start with the fully automatic evaluation of the exercises. But let's be a bit more specific. You run through the different phases of the exercise: tibia, soft tissue release, femur, or the other way around, depending on the chosen workflow. You then come to a point where you believe that you have reached an acceptable solution of the exercise and you press the finish button. From that point on, you cannot make any changes on this specific exercise anymore. Rather, the NeeCAT tool will automatically present you the evaluation of your results. Hereby, every value you have entered along the way will be compared with what our algorithm of NeeCAT has done. If you match the target value, it is shown by a green field. If there is a deviation between a chosen value of the trainee and the expected target, the specific field is colored orange or even red. We have implemented different thresholds for each position. The algorithm then summarizes all fields and puts it into 4 categories: balancing, HKA, resections/soft tissue release, and time. If one of the values chosen by the trainee is red, then the entire category becomes red and you have failed the complete exercise. If some of the values were orange, then you still have passed the exercise, but there is some room for improvement. And that is something that would be discussed in a one-to-one feedback session between the trainee and a trainer. Heiko, do you want to say something about the different feedback options?
Sure, Gunther. After each exercise, the users get immediate automated feedback. By that, most mistakes will become clear. However, in some situations, more or less confusion will persist. Therefore, we have a second option, the interactive feedback sessions. As part of our courses, in collaboration with our medtech or academic partners, the users not only get a consolidated group feedback, but also have the chance to have a one-on-one feedback session with very experienced trainer. And thirdly, we have practical teaching videos demonstrating how the trainer would solve certain cases with their explanations on their decisions.
That guides us to the training concept. How is the overall learning experience structured in NeeCAT?
We have 3 different courses: a basic course, an alignment course, and an expert course. We recommend to start with the basic course. Only a very few very experienced cast surgeons might be able to start directly with the different alignment modules. All the others, in particular all conventional surgeons, should start with the basic performance of digital knee surgery first. In the basic course, we start with a 2-hour web session and explain all decisions a surgeon needs to make with the 3 standard workflows, all of them being variations of mechanical alignment. In the next part of the web session, we will perform 3 cases together and explain the different decisions. After that, the trainees get a personal access to the NECAT tool and 10 tailored homework exercises. In each of the exercises, a specific patient situation needs to be solved. To increase the learning effect, the first 3 exercises are resettable, so the users can try it multiple times until he or she has understood the decisions completely. The remaining 7 exercises can only be done once, which is closer to the real patient situation.
So if I pass the basic course, I am ready for the advanced course. What is the focus there?
In the recent years, we have learned that classical mechanical alignment is not leading to 100% happy patients. A more individualized approach with modern alignment philosophies might help to improve outcome. However, all these strategies have different definitions and the pure number of variations is quite confusing, even for experts. Therefore, we have included 8 modern alignment philosophies in NECAT. It starts again with a 2-hour web session explaining all decision steps for each workflow, followed by various exercises for all alignment workflows. The training workflow is very similar to the basic course. You also have access to multiple videos and background reading material to strengthen your theoretical background.
So in essence, in the alignment course, the trainees learn 8 additional workflows and they learn how to use them. Besides the basic course and the alignment course, there's also an expert course, the masterclass if you want. Can you please elaborate a bit on this?
In the expert course, we focus on the effect and differences of the different alignment philosophies, and the trainee perform each case with different workflows. We have integrated a comparison button that allows quantification of the differences, including each cut and gap widths. Focus is on difficult cases such as TKA after osteotomies or hyperlex knees. Additionally, we have integrated the video format Learn from the Expert. In these 1-hour video tutorials, international experts give an overview on their alignment philosophy and describe tips and tricks. In an interview, we will also discuss the limitations of each technique very frankly. And finally, we will perform 1 or 2 cases together.
That sounds like a real learning experience. I believe this will help our users to become experts themselves. Does that mean that NECAT is not only for beginners but also for experienced surgeons?
I surely think so. And even after finishing the expert course, the journey has more to offer. For example, single alignment courses, again with international experts, with the integration of difficult cases by the trainees and interactive solution together in the expert group. We also prepare additional formats all along digital TKA surgery, such as conference summaries or paper presentations. According to the statement, learning never ends. We should always take the chance to become better.
That's a great end of this video. After these 3 episodes, you are now ready to start your own digital TKA journey with NECAT. If you are interested in NECAT, please follow us on our social media channels. But you can also contact and book a course with us directly. Simply send us an email and we will get back to you shortly. So thanks for watching and we hope we will see you soon in one of our courses.